Thank you, everyone. We are now moving on to section 2 of the day, where the focus on igniting youth involvement for TB eradication. So thank you for your patience as we are getting the panel ready. And we are delighted to have speakers who will talk around aligning stakeholders for deliberate, meaningful, and broad inclusion of youth as part of the solution and a voice in policy sharing for TB eradication. First up is our panel on your, so thank you for your patience as we are getting the panel ready. First up is our panel on youth advocacy to accelerate TB eradication. I welcome two moderators, Kanendra Kristandia, Asia Pacific Regional Manager of Global TB Caucus Secretariat, and Dr. Snehal Bhagat, Asia Pacific Regional Coordinator of Global TB Caucus Secretariat as well. They will introduce their panel. Welcome both. Thank you.
Thank you so much for that introduction, Christina. And I would like to welcome all of you. Good afternoon and good evening to all the distinguished speakers, panelists, and participants. Thank you so much for joining the second Asia Pacific TB Forum. I think it has been an amazing set of events since yesterday, and this is the last panel for the forum. Okay, when we talk about TB in youth, there are many important considerations like raising awareness, getting them motivated, and most importantly, to strengthen the advocacy with the decision makers. In this panel, we have a very interesting discussion between the youth representatives from various organizations with the key decision makers and the NTP leaders from various parts of the Asia Pacific region. To dive deeper into this, I would like to invite Ms. Akanksha Labde, who's the Regional Director for the Asian Pacific from UNAIDS. Over to you, Akanksha. Thank you. Akanksha, we cannot hear you. We still cannot hear you.
Okay, 1 second.
Yes, we can hear you now.
Okay, you can hear me now?
Yes, thank you.
Okay, yeah, thank you. Yeah, so today's session is all about the youth advocacy and the youth acceleration. So since I can relate to tuberculosis a lot because I was myself a patient, I was MDR tuberculosis patient, and I have been in the treatment for past 2 years. Now I'm completely cured, but that was only possible because, you know, there was a kind of drive in me that, okay, I want to get better. And I think people who have tuberculosis out there, everybody should not give up on the medications and on the treatment, because that is what tuberculosis is about. Once you stop the medications, once you stop the treatment, it's going to be hazardous for you. Until and unless you just don't stop, it is not going to be very hazardous to you. So, and especially I can see in India, I have been in past 2 sessions, I have been there was a session wherein I was invited to speak. In that session, one of the doctors mentioned that there are almost 1,300 lives who are getting affected by TB every day. And there are almost the same amount of number are getting killed because of TB. And I think that is only because, you know, there is no awareness about the disease of TB. And I think this session, this event that we are doing on a global platform, I think it's a great session to understand that it is very important to have the awareness of tuberculosis, especially in a country like India, wherein, you know, tuberculosis is a very, very serious issue, but it is overlooked, I can say. And it is also a great myth amongst people that, you know, tuberculosis is just affected to the people who are, you know, you can say poor or who live in slums. That's absolutely wrong. That is it's a myth. Tuberculosis can happen to absolutely anyone. So that is my take on it. And I think to talk about India, what India is doing for it, I think there is an NTP program. I think and in that program, it is supporting the TB patients a lot, wherein we are getting all the medications free. In fact, I myself got all the medications for free. And because of those medications today, I think I am absolutely fine. There was a medication called as bedaquiline, which was introduced. And because of that, I think MDR tuberculosis has been treated very easily nowadays. Otherwise, there was injections, almost 15 to 20 injections, which people used to take before that. But I think now everything of that is skipped because of that one medication. And also there are programs for the youth. There are youth programs wherein, there is a drive going on. There are Instagram, on social media also, we have a page called as Be the TB Change Maker. And on that platform, also there are many people coming up and they are sharing their stories. There are people who are helping out the ones who are there are some people who need financial aids. The government of India is also helping to the same. Every month 500 rupees, there's a certain amount which is deposited in one's account who are affected by TB. Also, there is an app which records each and every progress of your treatment, and when you need to go to the when you need to go and do the checkups, each and everything has been updated. So I think the technology is also helping a lot in advancement for TB eradication. So yeah, and I think the youth coming up and doing it is a very important thing, and I think we can see that a lot. So yeah, so over to you, Dr. Snehal.
Thank you so much, Akanksha, for that lovely speech. I'm sure that in India, the National TB Elimination Program and TB has been doing tremendous work, and the dream of our Prime Minister Narendra Modi of eradicating TB by 2025 should not be far. Just hoping so on a positive note. Thank you so much, Akanksha. Moving on, that was Akanksha from the TB Changemakers. We have wonderful pairings of the youth representatives and the NTP leaders from now onwards, who will be having a dialogue among various themes around TB in youth. So when we talk about TB in youth, we need to ensure youth-centered TB services, which are not commonly seen in most of the countries, right? And there are no better agents of change than the youth themselves. And hence, I would like to invite our first pair of esteemed speakers, Wang from 1+1 Leaders from WHO, who's the Technical Officer, Global Tuberculosis Program from the World Health Organization. And she's paired with Dr. Gerard Belimac, who is the Medical Officer for Infectious Disease Division, Technical Integration, Disease Prevention and Control Bureau from the Department of Health, Manila, Philippines. We welcome you, Wang and Dr. Gerard. The floor is yours. Thank you.
Thank you. Let me share my slides. Thank you, Snehal. Please let me know if you can see my slides as well.
Yes, we can see. Thank you, Yi.
Okay, thank you so much. Good morning and good afternoon, everyone. Great pleasure to represent WHO's 1+1 initiative, mobilizing youth to end TB, to join this panel discussion, along with dear Dr. Gerard from the Philippines. My name is Wang Yi. I work with the Global Tuberculosis Program at the WHO Geneva headquarters. First of all, please allow me to take this opportunity to start with a brief introduction about the WHO's 1+1 initiative and what we've been doing on mobilizing youth to end TB. As you are all aware, despite progress over the past decades, the COVID-19 pandemic has reversed years of progress made in the fight against TB. According to the newly released Global TB Report 2022, for the first time in nearly 2 decades, WHO is reporting an increase in the number of people falling ill with TB and drug-resistant TB, alongside an increase in deaths. Tuberculosis remains one of the world's top infectious killers. Young people with the age group of 15 to 34 years are being the most affected group. Young people also form the majority of the population in most of the high TB burden countries. However, as you all know, young people are important stakeholders in the Sustainable Development Agenda, in achieving universal health coverage, and in ending the TB epidemic. It is vital that young people must be at the center of the fight against TB. In 2019, WHO launched an initiative titled 1+1 Mobilizing Youth to End TB. This initiative aims to advance the engagement and amplify the voices of young people in the fight to end TB. The 1+1 initiative relies on small actions that young people can excel at and multiplier effect utilizing the untapped resource of youth. If each one reaches one, we can reach the millions. Today, the WHO 1+ initiative has expanded to include over 30,000 young people across the world. Social media platforms and social media posts are followed by over 20,000 young people, with the number growing each day. More than 100 youth-led activities and events on ending TB have been conducted worldwide. This includes peer education in schools and universities, sensitizing young people, encouraging them to become TB advocates, and supporting TB patients in the community with resources and advice. During our close engagement over the past years with young people from all over the world, we know how important and how hard the meaningful youth engagement is, especially at the policy-making stage. Ensuring youth-centered TB services is not just a slogan, and it needs to be taken up to the next level. Here in this dialogue today with Dr. Gerard, representing youth, I would like to ask 3 questions. First, how does the TB program and services ensure alignment to the needs of young people? And the second one, in what way can young people support the policymakers and the national programs to make the TB services more aligned to the youth and their needs? Third, as you all know, we're preparing for the next year's UN high-level meeting on ending TB. What is your vision on youth contribution towards shaping a world free of TB? And how can we encourage more youth to join this global fight against TB? Thank you so much. I will stop here and hand over to you, Dr. Gerard. Thank you.
Thank you, Yi, and thank you to the organizers for this opportunity to speak on behalf of the NTP managers and policymakers in the region. Of course, I'd be speaking for my country, Philippines. In our country, the youth has a big potential, knowing that estimated third of our population is less than 15 years old. No? And if we do the 1+1 strategy, I couldn't agree more with the 1+1 strategy of WHO that indeed we would be reaching out to the missing TB cases. The first question is how we ensure alignment and of our services to the needs of the young people. First is, I guess, what is important for the policymakers is data, no? And it is through the data collection that would tell us which segment of the population should we need to look into. And clearly, in our data and information systems in the Department of Health, there is a lag between the notification rate and the estimated TB cases among the youth population. Without knowing this, we will not be able to respond to the needs of our young people. No? Second is the Department of Health and the Philippine government now is working towards provision of universal health care to all Filipinos. And we focus now, instead of a few diseases, we focus on the needs of the life stage of the person. So we segmentize our programs based on the needs of the newborn, based on the needs of the child, the youth, of course, the adult and the elderly, so that we will not be missing any single issue and health concerns of the individual if they are in contact with our health systems. For these integrated health services, the standards of care per life stage is defined so that it is sensitive to the needs of the specific age group to the different diseases that they are facing. And of course, TB is one of the highest form of communicable disease in Philippines, and so they are integrated in our health standards of care through life stage. So we carefully make sure that even the newborns will have specific TB services, the child, the adolescent, and the elderly and the adult population. And thirdly is also making sure that we acknowledge the other role of the other sectors in our society. We know that the health outcomes of each person or of our citizen would only result from would only we achieve the better health outcomes for each citizen, only 20% of which is attributed to their contact to the health system. The remaining large population of 80% actually results from their interaction from the other social sectors, their interaction with the infrastructures in their household, in their community, and in their schools, such that the government agencies that are in contact with the young people should also be able to craft policies that would enable learning and also making sure that the young people will have an enabling environment where they can engage in healthy conversations, they can teach their peers, and they can easily access and be referred to the health services. So it is important for the governments to acknowledge that TB disease is not only a health sector issue, rather it is a multi-sectoral issue, and that the Department of Health should reach out to the other sectors such as the education sector, the social services sector, those which are relevant to the TB disease. And we are doing that now since we have created our TB National Coordinating Committee, and it is being created by law, and it is our platform for advocacy to the other government agencies. The second item, I think, key was on how we engage the youth support in the TB programming. I think it is very important that the youth should engage themselves in local activities. Now we start small, we start at the smallest units of our villages and our communities, help engage and cooperate with local health authorities, and also bring our friends and peers to be engaged in healthy conversations regarding TB and other communicable disease, and of course other issues affecting the health today, and that we encourage the youth, of course, to continuously improve their knowledge so that they become better teachers and better peers to their friends in the schools, and by being able to know many things about TB, how they can be prevented, how we can access the services. I guess it is the duty of every government and every health system to provide the quality health service to the youth and to the citizens. So the youth will have in a better position because they know the basic knowledge of TB, and that it is also their duty to maybe ask for better health services from their government, and they can, of course, verbalize this, or maybe they can express this by participating in community assemblies. They can, I guess, they can directly provide feedback to their local health authorities. But if they are a bit shy, at least they can join civil society organizations that are addressing the needs of the young people as well. And thirdly, the question is our vision here for the participation of the youth in TB elimination. I guess because I truly believe, of course, and no, this is beyond question, that the youth have the biggest potential to develop and engineer innovations. No? The youth should not be contented by being beneficiaries of the health systems. The youth should not be contented by being end users, by being the targets of our health programs. Rather, the youth should organize itself so that it is an active partner of our local health system and be able and enable the government and the local health system to design better programs for the youth. I think we have this saying that there is nothing about the youth without the youth. It is the youth who are better positioned to design the health programs for their community. I guess I would like to end my intervention here. And again, thank you for this opportunity to share my thoughts on this forum.
Thank you so much, Dr. Gerard. That was a wonderful discussion. Yi, do you have any counter questions for Dr. Gerard?
Thank you so much. It's really rich for answers to all these questions. I think I really enjoyed this dialogue with Dr. Gerard, and all the points that Dr. Gerard mentioned is also well aligned with WHO's 1+ initiative, the aim, and also our multi-sector accountability framework. So I would say we will do our best to work for youth and with youth, and we're looking forward to the free TB free the word of free TB. Yeah, thank you so much.
Thank you so much, Wang and Dr. Gerard. I think it was a very interesting discussion and very insightful, I must say. You are extremely right when you talk about youth are better positioned to design the health programs for youth and no one else but youth. And they can be the active partners for the local health systems with the integrated health programs and services. I'm sure that Philippines would do wonders with this kind of strategies and with you in place there. Thank you. Moving on to our next pair of speakers, we would like to invite Ms. Bruna Concho-Pretero. She is the grassroots advocate from Results Australia, and she is being paired with Honorable Kim Min-soo, who is the member of the National Assembly from the Republic of Korea and also the Asia Pacific co-chair of the Global TB Caucus. Unfortunately, Honorable Kim cannot be live with us right now. However, he has pre-recorded the session for us. And it would be really interesting to know about this theme of mobilizing political will to involve youth in TB prevention and care and increasing the political advocacy to end TB. Over to you, Bruna. Thank you.
Thank you so much. Just bear with me while I share my screen. Can everyone see my screen?
Yes, Bruna, we can see.
Yeah, perfect. So I would like to start today by thanking the organizers for having me here. I'm delighted to be here and excited to share my experiences in the hope that it may inspire and motivate people. Just a little bit about me. I'm from Brazil and I have been in Australia for the past 5 years. And I have been a volunteer with Results Australia for about 4 years now. And I started my journey with Results as an advocate and then became the group coordinator for the Australian Capital Territory 2 years ago. And this year, I also joined the Results Fellowship Program. So here at Results, we work to empower everyday people, and including youth, to use their voices to end global poverty. And most of the work that we do relates to fighting against diseases of poverty, with a special focus on TB. So fighting against TB, it's something very close to my heart, as not only my country struggles with it, but I had family members and students affected by this disease, and I know how devastating it can be and the long-lasting impacts that TB has. Here in the ACT, our favorite moment of the year is when we campaign around TB. So every year we participate in the Light Up Red for TB event, which consists of lighting up buildings red to raise awareness about TB. So you can see here in my slides a few photos that we lit up red last year and then this year. And this comes with challenges as well. So you can see this year someone lit up a building purple instead of red, but we were still there and we were still able to engage with the community, which was the main goal of the campaign. So during this campaign, we also engaged with the media, traditional media, and also social media to spread the news pre and post event and to be able to engage with the community a little bit more. So every year, more and more everyday people, they come to us, they stop by in these lit up red buildings to talk to us about TB. And it's a real pleasure to me to be able to get the community involved in our campaigns as well. Another big part of our campaign is our MP engagement, which is when we meet with members of parliament and senators to advocate for the fight against TB. So we meet with them and we provide them with information, statistics, facts, and directions for where we want them to go, or we have a clear ask, like, could you write to that minister advocating for this or that? So our work is really based on creating and maintaining these good relationships with our decision makers, our MPs, and providing them with information that they need to make informed decisions about TB and other diseases of poverty. Last year, during the pandemic, the peak of the pandemic, we still maintained these relationships with our MPs and senators. So you can see in my slides as well, we maintained this relationship via phone call, emails, and Zoom meetings. And now, because we're not struggling as much with the COVID pandemic, we resumed our meetings in person. So you can also see our youth being represented, engaging with one of our local MPs here. Year after year, we see how our MPs change in relation to this topic and how well educated they are and engaged they are with us during the campaigns. So one of the examples that we have is our member of parliament here for the ICT for my area, my electorate, is the one depicted in the photo that we're meeting in person. So I joined Results about the same time that she joined the parliament. Her name is Alicia Payne, and in the beginning, she didn't know much about Results and she wasn't really involved with the cause with fighting against TB, but we knew that she has interest in fighting to make people's lives better. So we got the hook with what she was interested in and decided to engage with her a bit more. So in our one-on-ones with her, my calls to her, my emails to her in our meetings, we would provide everything that we could so she would have all the information she needed about Results and about TB. So this year, 3 years after I met her, this year we met with her again, and I was amazed to see by how much she knew about TB and how engaged she was. And she even decided to become a member of the TB caucus. And for me, this is really great to see that our work has a real impact. And finally, for me, the keys to successful grassroots advocacy are engaging youth in the cause, building youth leadership, building and maintaining good relationships with local representatives, and being patient. Similarly to the 1+1 discussion we just had in the first pairing, I strongly believe that big changes take time, but that every step along the way counts. And we have to enjoy every step. We have to enjoy the journey as well. So here at Results, we do have fun as well while celebrating, raising awareness for this important cause. Now, I would like to ask a few questions of the Honourable Kin on youth and political advocacy. So my questions are, why should youth be involved in mobilising political commitment to end TB? And what are the methods they could use to advocate for TB? And finally, I would also like to know, what is the role of parliamentarians in ending TB and how can youth support this effort? Thank you so much.
Bruna, thank you for your pitch and questions. I'm glad to join the panel dialogue to discuss this important matter with a youth leader like you. The ad hoc committee meeting was scheduled yesterday. For this, I sincerely apologize to all of you for participating in the panel discussion in pre-recorded video remarks. I will start by saying that every young person has the right to a safe and healthy life. Yet, TB, the world's top infectious killer, continues to violate this very right. There is a substantial increase in the incidence of TB, with an estimated 1.8 million adolescents and young adults worldwide developing TB each year. This increase is worsened by the onslaught of the COVID-19 pandemic, which hinders progress in case notification and treatment coverage. This high incidence is magnified by the fact that most of the world's youth live in low and middle income countries where TB remains common and young people make up a quarter of the population. Despite these facts, adolescents and youth have not been addressed as distinct populations in terms of TB policy making or treatment services. The evidence suggests that current care models are not meeting your needs as a young population. You, as young leaders, can create this demand to push for a stronger emphasis on youth in all aspects of TB prevention and care. One of the avenues you can explore is through involvement in mobilizing political commitment to end TB. Engagement with political representatives is crucial to mobilize domestic resources, strengthen national legislation, and ensure oversight and accountability on TB response. Your voice as a young person is needed along this process to ensure no one is left behind. As the Asia Pacific co-chair of the Global TB Caucus, I work with a great network of parliamentarians to collectively advocate for stronger political will to end TB. We have seen increased domestic resources for TB, improvement in the foreign aid budget, more robust regulation, and sharper accountability in many countries in the Asia-Pacific region, all of which are driven by parliamentarians. We are committed to ensuring young people are at the center of TB prevention and care. As a youth advocate yourself, working closely with Results Australia, we are inspired by what you do on the ground. You met with individual MPs, support the National TB Caucus in Australia, and advocate for stronger political will to the elected representatives. You are a true inspiration, which hopefully can be replicated by other youth organizations worldwide. You have the means and networks. You can mobilize the world. You can lead us to a better future, a bright and healthy future without tuberculosis. Thank you.
Thank you so much, Bruna and Honorable Kim. That was a really great discussion. Cannot agree more that engagement with political representatives to increase the political will is extremely crucial to mobilize the resources to end TB. Thank you so much, Bruna, for that wonderful presentation. And I'm sure that you're going to do amazing work with Results Australia. Thank you. Moving on, I would like to invite my colleague, Mr. Ganendra Kristandaya, who would be moderating the event from now onwards. Over to you, Ganendra. Thank you.
Thank you so much, Snehal. When you call me Mr., I feel very old, but as you know, I am part of the youth population and very, very happy to be here with all the distinguished speakers and also especially the representative from the youth leaders. So as a young people myself, I would like to strengthen the quote from the NTP managers, Dr. Gerard from the Philippines, that nothing about youth without youth is for youth. So what we're discussing now since the previous day as well, is how we can make sure that youth become the center and the future of TB response. And as the part of the Global TB Caucus, we believe in multi-sectoral collaboration to end TB, because for us, it takes a village to end TB. Now, I will bring you, all of you, to hear from the experts in Indonesia. We have Siva Anggita here, who is the lead of Indonesia Muda untuk Tuberculosis, or Indonesia Youth Movement for Tuberculosis, and also my previous boss, Dr. Imran Pambudi, who is the Director of Communicable Disease Prevention and Control of the Ministry of Health of Indonesia. And both these wonderful pairs, they will talk and discuss about the overall role of young people in TB prevention and care. We would love to really hear from both of you. So the floor is yours.
Thank you, Ganendra, and thank you for inviting me and organizing this very wonderful event. So it is an honor for me to be able to speak here to discuss on how youth participation can contributing to ending TB in 2030. Greetings, Honorable Dr. Imran Pambudi, panelists, TB colleagues, and champion all over the world. My name is Siva Anggita, and I come from Indonesia, which today I'm speaking here as the leader of Indonesia TB Youth Movement. This movement is being established by the young people, which supported also by the WHO and NTP, and the member of within the movement is very diverse background from the young people. So today I will briefly share about the works that we have been done and I think that we can discuss more or the further works that we can do together. So the thing is, there is an urgency of including a young population for the TB elimination. If we can see from the incidence and the case of the young populations age 15 to 34 among like almost 30% of the cases is from young populations. This has happened not only in a global, but also in regional levels and also in the country levels. So in addition to these backgrounds, we find that there is still many young people finds quite challenging for their health-seeking behaviors. And there is also an increase of the hoax and the misinformations that is massively spread about tuberculosis. So in here, my team and I have been contributing in raising TB awareness for the few years ago, and we have a significant campaign that I'm going to highlight after this. So the first campaign is about the landscape campaigns. This campaign is an effort to raise TB awareness in artist populations, which we are aware they are also have a high risk population in being affected by TB. So this campaign is a meeting up between the artists and also the TB survivors. And after they are going to have one-on-one discussion, and after the discussion, the artists or the painters will create and produce a personal art that telling the stories behind its survivors. This campaigns, the objective of this campaign is create empathy while we are still educating people on what is tuberculosis, on how people who affected by TB is going through their treatment and why people should aware about it. And the second campaign is the campaign of the hashtag Lawan TBC campaign, which is a joint campaign that's supported by the NTP. TikTok Indonesia and also with medical influencers called TikTok, and this campaign is gained about 99 million users engagement in TikTok, and this campaign is fully taking advantage of the technology behind the social media platform. So in here, it is really great to have Dr. Imran in here. So we know that as the most impacted young people, it is if we would like to scale up the effort, so it is really important to including the young populations. Despite all of the all of the support and the resource that being provided under Dr. Imran leadership. So we still find some challenges in here. We find that the initiative, how to make the initiative from the young people became sustainable, and then how we can like access the resource and how we can empower more young people to contribute into the public health sectors. In this case is particularly on tuberculosis, and then how we can have more decision makers, like in this case, like Dr. Imran, to have more trust to the young generations. So as I have opportunity to hear, to speak with you, I would like to raise questions for you. You've been very supportive of the young people initiative, and under your leadership, you create a very enabling environment for young people to thrive. So in here, some questions that I'm going to ask is, how do you see young people contributing in achieving to NTB target, and how do you think that we can have more meaningful engagement in the near future that can be more sustainable and contributing to the effort to eliminating TB in 2030? Thank you.
Pak Imran, please, the floor is yours.
Okay, thank you, Awang. So, Siva, thanks also for your explanation and your encouraging statements about the Indonesia situation now. So I think I want to share you some several points here. So I think in 2021, Indonesia has the presidential decree on tuberculosis. I think this is the good and the strongest commitment from the government, how to handle tuberculosis. And in this presidential decree, it's also mentioned that the participation from youth is also important one. It means that we in the Ministry of Health has also acknowledged what is the importance of the support or engagement from the youth. And I think we also knew that from the numbers, the TB cases from the youth age from 15 to 24 years old is around 72,000 in 2021. It means around % from our estimated cases. So I think these numbers is also shows us about how importance of protecting them, protecting the youth from the tuberculosis, since tuberculosis will affect not only what the health, but also the productivity, and also it also have impact to the future, their future, and also their family. So it means that it's very important how to engage and protect the youth from the this disease, the ancient disease. And I think from your questions, how the youth can be more what we call involved to the TB program. I think what you have done is very, very useful, like how you engage the social influencer like TikTok. I think that's a good one. And also I think for the this engagement can also be funded by the program, especially in the Global Fund Initiative. We also have the what we call the activities to engage community sectors. So it means that it could be expand to the next few in the future, how we can deal and how we can more engagement with the youth, especially for the social media. And the other area that we can also improve is also pramuka or boy scouts, yeah, because we have quite big numbers of boy scout, and we have, I think we have already have like uh uh like what we call the engagement with them, like the medals that the boy scout, which they can encourage, yeah, the TB patient to have the treatment, yeah, regularly. The boy scout can have the medals or something like that. So I think it also can be expand to another youth association or youth initiative. The model that we already developed with the Indonesia Boy Scout, or we call it Pramuka. And the other area that we can also expand is also how we can deal with the medical student association, yeah, because they will bring the their members, yeah, how they can deal or how they can learn, yeah, from now, how to handle, how to educate the TB patient that needs more attention in the future.
About the
So
practice.
I think lastly, me from the Ministry of Health, we're very happy to discuss, to engage others participants, other sectors, others initiative, especially youth initiative. Like I call many times that my my duty in Ministry of Health as a director is I want you to let me help you, yeah, to help me. Yeah. So it means that because health is inclusive, so sometimes people want to help or participate in the health sector or health program, but they didn't know how they can help the program. So it means that I want to help you to help me. I think that's my comment. Thank you, Awa.
Thank you very much, Bapa. That was a really, really wonderful commitment. And I'm afraid we have a very limited time for this. So thank you so much, Sifa, and also Pa Imran. We have seen how youth movement has been very massive in Indonesia. Millions of young Indonesians has been engaged. There are regulations ensuring youth engagement. And also we hear firsthand that Dr. Imran is very committed to involve young people further in the TB program in Indonesia. But does this effort needs to be scaled up? Is there any other factors that we need to think about? I think one of the fundamental aspect is definitely on funding issues. Therefore, the next pair will discuss about fundraising and crowdsourcing strategies for youth-focused TB initiatives. We have Andi Firmansyah here, who is the team lead of the advocacy unit from 2030 Youth Force Indonesia, and also Arindam Goswami, the head of human resource at Adani Ports on SEZ. I will leave it to Andi and Arindam to discuss further about this matter.
All right. Thank you, Sawang, for the times, and also thank you for the FVPN to conducting these forums. So firstly, I would like to a bit introduce our organizations. What is the things that we have done so far, especially in fundraising and developing strategies to end many specific youth-based issue, including the tuberculosis and also other issues. So currently, if I may speak, that now we are receiving grant from some donors, and it is not only from the private sector, but it is also some of the donors is called it is giving in the GSR scheme like that. So if I can see, the most important things that we as the youth organizations in doing these fundraising things to support and develops our organizations is the first, we can strengthen our organization value through our activities and program, which it is also need to be consistent. So for example, we are focusing on the accelerations of sustainable development goals. In number 3, about the good health and well-being. So we are trying to really consistent to conduct, to research, and also to advocate the things that we can understood as our values from our organizations. Because why? With our values, it can help for us to find another partner to support our activity. And in this time or in this chance, we will really discuss specifically about how we can do fundraisings, and also how we can collaborate with private sector and also GSR programs, for example, and also maybe from the government also. And then I also want to suggest, based on our experience, please, it is really important for us to not hesitate to build our networks with other actors such as private sector, government, and also other donors to push our branding like that. So maybe it is a bit a bit introductions and also a bit experience from 2030 Youth Force Indonesia. And in this time, I'm really honored to be speak with Mr. Arindam, and we will discussing more about how the fundraising programs. And maybe I would like to give a simple questions to Mr. Arindam to discuss, to continue our discussion. So how you see the importance of fundraising for youth-based organizations in many many specific programs. And also, if I'm not mistaken, if we are talking about the GSR programs, maybe it could also relate it with some things called as workplace interventions. So I would like to ask to Mr. Arindam to also speak about that. Thank you.
Good afternoon, everybody. Thank you, Andy. Thank you, Ganendra, and good afternoon to all the other delegates and the panel members. An absolutely important question that we have to mobilize the youth and take the youth into consideration in driving such an important movement, which is almost like a clarion call by our Honorable Prime Minister in the country to eliminate tuberculosis from India by 2025. And what I personally feel is that one of the most important vehicle to drive such a social issue in a country as large as India would be mobilizing through the student community, which is primarily the youth or the future of any nation, whether be it schools, be it educational institutions, be it other youth forums. They can kind of, take this entire movement in two aspects. Number one aspect, I would like to kind of, bring it to kind of notice everybody, because we all experienced a kind of 18 to 24 months of a global pandemic, which probably nobody here in this call would have experienced. And I think we should take the entire case study the way WHO and the respective government of each country, they ran a program in terms of communicating and making their respective population aware about COVID. It's a case study itself. I think, and to our surprise, as all of you might be knowing, even today, tuberculosis takes away more lives than COVID did in 2 years. Given that as the fact, and I think the youth should kind of come ahead in partnership with the government to kind of drive a large-scale social awareness about this whole disease, that if it is kind of detected in time, cured in time, it is absolutely a curable disease. Now, in this regard, I would like to kind of bring in another aspect, that what we as an organization did, wherein it is very important from the youth organization, that how do we go about in kind of garner resources, organize funds to kind of drive such programs. It has to be in collaboration with all the three large actors in any country. So obviously the biggest and the most influential actor is the government of a particular nation. And then comes the social sector, then comes the government sector, which are into business. And then there is the large corporate private sector, which kind of, does and is responsible for employment, driving the economy and the growth of the country. Now, as a part of a responsible corporate citizen, we last October decided to kind of do a workplace intervention at our workplace. Now, I represent a company called Adani Ports and SEZ Limited. We are India's largest, seaport operator. And I represent a seaport called Mundra, which is India's commercial seaport. So we, as an intervention, decided along with our CSR wing that we will make Mundra port tuberculosis free. Now, what it meant was, it meant to kind of ensure that all the 8,000 odd people who work at the port, and they come from various economic strata. In terms of various economic strata, how do we kind of make them educate, make them aware, and then how do we screen them to ensure that everybody is safe? So we obviously started off in a planned approach in terms of, we kind of first took some policy decisions in the organization. The first policy decision which we took, that in case in this intervention of ours, if any worker is kind of detected with TB, the organization would support the entire treatment of that individual, and also would provide him or her the security that his or her job is safe. The entire absence, for which the period which the individual will not be able to attend work, will kind of be treated as a special leave, so that the individual doesn't lose any of his or her pay or benefits. So that was the first assurance we kind of put it out as a commitment of an organization. Then what we did was, we kind of created a pool of master trainers. That's the resources the organization committed. In terms of many of your senior resources were kind of put into a rigorous 2 days training program. And where we created a pool of almost like 60, 65, 70 master trainers. Then these master trainers, in a planned way, did sessions all across the port to cover all these 8,000 workforce in an awareness session. Apart from this, we used a lot of other communication channels, including audiovisual aids, posters. We also used innovative things like, we organized theaters, stage shows by the children. And that attracted a lot of eyeballs, and it basically helped us to spread the message. And then what we did was, we kind of took the help of a lot of medical professionals and the youth organization in and around our facility. And we created these health camps in the port, wherein over a period of 2.5 to 3 months, we health screened almost this 8,000 workforce to see whether they have any symptoms, or whether they have any particular symptoms for any tuberculosis, or for further diagnosis. And to our surprise, there were around 20 odd people whom we had to kind of send for further diagnosis by way of X-ray, by way of CT scan, and also a specialist doctor consultation. And I'm happy to state that luckily for us, means nobody was kind of positive and everybody was safe. So this was an experience of ours where we thought that if this is replicated by most of the organizations, and here the youth organizations can play a big influential role by partnering with the government and with large corporations in the country to ensure that their respective workplaces are free of tuberculosis. I think that's where it actually serves the dual purpose, in terms of, if the respective organization commits the resources, commits the funds, then this intervention also is taken through, and the youth organizations can also lead and support the private sector organizations by providing the content, by providing project management support, and in a partnership, I think this large-scale, a noble cause of eliminating tuberculosis from the face of our earth, I think will kind of take shape. Thank you.
Thank you so much, Arindam, and also Andy. This is a very, very amazing discussion. We learn that at least there are 3 actors, very important actors. If we want to further engage with young people, we need to involve government, the social sectors, and also the corporate or the private sectors. And I think youth plays a very, very important role as the bridge to connect between these actors and push the boundaries of collaboration further. Thank you so much, Arindam, and also Andy. Unfortunately, again, we do not have enough time for the Q&A session, even though there has been several questions that we receive in the platform. Therefore, I also encourage the distinguished panelists here to respond in chat, be it here in the Zoom or in the platform, so we can address some of the questions. Thank you so much, Andy, and also Arindam.
Thank you. Thanks.
So for the past 2 days, we have heard from young people, we have heard from experts, from policymakers, parliamentarians, and other stakeholders across the globe. We understand that the scope of TB problem in Asia Pacific is an enormous one. We also understand that there are gaps in the involvement of young people in TB prevention and care. So my question is, to summarize the panel and also hopefully the 2 days, how can we address this issue? Several summary that I would like to provide. Number 1 is that we need to make sure that the role of young people is embedded across the TB program. And number 2, we need to make sure as well that policymakers create an enabling environment to make sure the involvement and meaningful engagement of youth in at least 3 areas based on our discussion. Number 1 is advocacy, campaigning, and accountability. So in activities like raising awareness, policy development, monitoring, and also evaluations of the program, youth needs to be involved. Number 2 is youth-led service delivery and also research. So involving young people in decentralizing the TB service, involving them as peer supports, as educators, and also as in important parts of the research itself. And lastly is on community financing, demand creations, and advocacy for resource mobilizations, and also exploring creative avenues to finance youth activities. So hopefully those key takeaways can be further implemented by the policymakers here, and we can really see changes happening on the ground. Allow me to close this panel with a quote from the first president of Indonesia, Sukarno. I'm sure my fellow Indonesians here are very familiar with the quote. He said, "Give me 1,000 old men, I will reap mountains from its root. But give me 10 young people and I will shake the world." That's why young people is very important. The future of TB elimination lies in the hands of young people like us. Let's shake the world together and make sure that we have a future without tuberculosis. Thank you very much.
Thank you to the panelists and the wonderful moderating. I also want to take the opportunity to thank all the moderators and esteemed panelists for the amazing job, their expert sharing, and really the journey that has taken us the last 2 days around this topic. Before we head to the closing address, I would like to do a similar activity that we did yesterday. And I would like for you, the audience, if you look in the chat box, we have a word cloud again. So we would love to hear the words that have resonated to you, whether today or the last 2 days. Do click on that link and we will see what comes up. So let me see if that screen will be shown again. And again, if you'd like to type in the language you feel most comfortable, please do. I would like to add as well, there'll be a second link, and we really want to hear from you, your feedback. And we have 3 questions. I should just take a minute to answer, and we would really appreciate if you could give us your thoughts around the 2-day event. Finally, last update, and this has been asked to us a few times. We are very happy to share again that the event platform is available for online access for about a month after the event. So do feel free to watch the playbacks, connect with each other, whether with the speakers or other participants on the AVPN connector. And we hope that this will contribute to more meetings, more collaborations, and more impact. Now, do we see any words that have popped up? Can we refresh? Let's see if it's working. Oh, I hope technology is going to be on my side here. We'll do 2 more refreshes and see what happens. But really, again, to the audience, thank you for your patience and your grace as we have worked through the technology. Overall, it has been going quite smoothly with just a few little hiccups here and there. But really, thank you to moderators, speakers, and this fantastic audience for being so engaged over the last 2 days. I'll give it one more go. Oh, I've got one word. Oh, collaboration. Well, that's amazing. That's exactly what I had mentioned verbally. So glad that that has popped up. I actually have here in one of the chats, we'll have to insert it into the word cloud, and that is awareness. So awareness, collaboration, awareness. Let me see if I can get another word or 2 out of the audience. And even as we're not sharing, it might take a little bit of time. Please put your words in. We will capture it in the summary after the event. One more refresh, please. Let's see what comes up. If not, I think collaboration is quite a powerful word to wrap up and to move then to the closing address. And we're delighted to welcome the Honourable Warren Ench, who's a member of the Australian Parliament for Leichhardt and Asia Pacific co-chair of the Global TB Caucus, and the wonderful Juliana Chin, who has been driving this conference with the team. It's such a pleasure to have her close as well. She is the Regional Public Health Strategy and Impact Lead at the Global Public Health at Johnson & Johnson. So welcome both. And again, to all, thank you for your participation. Thank you.